You see a lot of families and patients who are in distress, patients who become so critically ill from COVID. It's become very overwhelming and stressful.
Working as an emergency room registered nurse at 2 Toronto hospitals during the pandemic is taking a toll on Ingram mental well-being.
I take one day, one step at a time, because that's all you can do.
She was able to access a few free counseling sessions through work, but says it isn't enough, and she's still feeling stressed out.
It's pretty much the same. With the limited number of sessions, I just don't think that it would be enough for anybody. The ideal thing would be to offer more sessions.
The Ford government is trying to help frontline healthcare workers like Chagala with a commitment of $12.4 million over 2 years to provide existing and expanded mental health and addiction supports. The money was included in last week's fall economic statement, but 4 members of Ford's cabinet provided more detail at an event in Brampton today.
We talk about economic recovery, but we know that we cannot have a recovery if our people are not healthy.
The province is partnering with the Canadian Mental Health Association, which tailored its workplace mental health programming to better suit healthcare workers specifically.
It's been great because the way the government structured this, it's in partnership with existing programs, so they're hitting the ground today.
Donna Duncan of the Ontario Long-Term Care Association calls the funds a step forward in addressing pandemic-induced mental health problems among healthcare workers in long-term care, which has driven people away from the industry.
We know anecdotally that we've lost about a third of our workforce.
Mental health problems resulting from the pandemic is having a similar effect on registered nurses. A March 2021 survey from the Registered Nurses Association of Ontario found more than 16% were either likely or very likely to leave the profession after the pandemic. RNAO President Doris Greenspun says the money is a step in the right direction, but says it isn't enough given the incredible stress the lengthy pandemic has put on nurses.
I am surprised we don't have more issues with mental health challenges.
I think it's long overdue. A lot of the stress started since the brink of the pandemic.
Matt Ingram, CHCH News.